All right. Everyone can see it, right? Thank you, Jamie. So in order to understand why cognitive health is important, we need to understand the basics of cognition. Put simply, cognition is our thinking skills. We use cognition to process information and make sense of our world. Cognition includes many abilities that work together for our optimal functioning, including the ability to learn new things, to pay attention, use intuition, judgment and decision-making, language and communication, memory, planning, organizing, goal setting, all those kinds of things. So let's look at a scenario that shows the way that we use our cognitive abilities in an everyday occurrence. If you're scheduling a doctor's appointment, you need to pay attention to the administrative assistant or whoever you're on the phone with, understand what has been said or written, think about other appointments and obligations that you have planned to avoid a scheduling conflict. You have to remember to write down the appointment and then remember to look at the calendar on the designated day. You also need to plan how you're going to get to the appointment and organize yourself to make sure you get there on time. You might want to make notes ahead of time about things you'll need to discuss while you're there. So you see, in order to do some everyday activity like schedule and attend an appointment, you need many cognitive skills like attention, language comprehension, memory, organization, and planning, all functioning well together. It would be challenging to get to the appointment if these skills weren't working well. You might be emotionally ready, you might be willing to be there, but if you don't remember it, or if you double book something, then you might miss it. Cognitive health is related to brain health and demonstrates how well our cognition or thinking abilities are working. A healthy brain is one that can perform all the mental processes that are collectively known as cognition. A healthy brain can handle both simple and complicated scenarios. So good cognitive health is often referred to as staying sharp or thinking clearly. If you are working with or know someone in good cognitive health, you might notice that they might be able to focus or pay attention for extended periods of time. They might be able to recall someone's name easily, keep a schedule up to date in their mind. You might notice them being able to cook a new meal with minimal difficulty, thinking and speaking coherently, and using common sense. And in contrast, poor cognitive health might look like difficulty focusing, not being able to recall names, missing appointments, not initiating activities or having difficulty doing so. For example, trouble with trying new things or introducing themselves to someone and starting a conversation. Thinking and speaking might be disorganized, and using poor judgment can also be a sign of cognitive issues. Cognitive impairment can be viewed on a spectrum ranging from mild to severe with potential to swing either way, depending on the circumstances. So where does cognitive impairment come from? We know that pre-existing or coexisting conditions can cause cognitive impairment. And while age is the primary risk for cognitive impairment, there are many other issues to consider, such as family history and education level, if there has been an injury to the brain, and even some medical conditions such as heart disease or stroke can cause cognitive problems. We also know that mental illnesses such as schizophrenia are likely to lead to cognitive impairments. Unfortunately, sometimes poor cognitive health can impact lives on a devastating scale. An individual with poor cognitive health not only has personal struggles, but broader consequences can often be seen in the following. The community can be impacted with individuals not being able to live independently. This can add stress to family and natural supports as well as community services. Mental illness can cause cognitive impairments and often begins in school-aged individuals. Think about high school or college, those formative years where problems with attention, memory, problem solving, and social skills could literally stop someone in their tracks by inhibiting their development. Research tells us that many individuals suffer a disruption to their college education after a first episode of psychosis. Fortunately, those who experience symptomatic recovery after psychosis have a significant likelihood of returning to college. But consider struggling with attention, memory, motivation, and even social skills while in college. Sadly, these individuals often struggle with self-confidence issues as they navigate their post-first episode lives. Not believing in yourself can have a great impact on your quality of life. One study showed that depression was associated with low self-esteem and that low self-esteem was a risk factor for overall decreased quality of life. Individuals with persistent mental illness often suffer cognitive impairments that disrupt critical thinking and problem solving. Most jobs include needing to remember new information, recall old information, and deal with changing demands. This is difficult when cognition is not working well. I'm sure many of us can relate to having stressful days at work, juggling many things, feeling overwhelmed. So imagine trying to do that when your memory, problem solving, motivation, when all that's not working well. It's easy to see how cognitive problems can affect one's ability to maintain and succeed in a job or a career. Research has demonstrated that people who have difficulty with cognition are more likely to be unemployed. And imagine how relationships might suffer when a person with cognitive impairments is not able to attend to or remember what a friend said. The ability to pay attention, to be focused, and not get distracted is vital for social functioning. The consequences of poor cognitive health are vast and can have a domino effect to negatively impact an individual's quality of life in their community. However, individuals struggling with poor cognitive health can improve and make strides toward recovery by engaging in programs meant to target those problem areas. With many causes and risk factors to cognitive impairment, you might be wondering how to maintain a well-functioning brain, or how do I keep my memory sharp? How can I improve my memory? Or maybe you're thinking, I know someone, or I have a son who's having a hard time paying attention. How can I help them? What can I do? What works? Well, I did a Google search for how to keep my brain healthy, and it produced over 400 million results. So how do you know what to do and what actually works? Well, here at the Best Center, we look at literature and at research, and research supports these practices as preventative measures for maintaining good cognitive health. Exercise, as we know, it's been shown to relieve symptoms such as insomnia, anxiety, and depression. In addition, studies suggest exercise may not only ward off cognitive decline and dementia, but improve cognition in people who already struggle with memory problems. One study showed that supported and supervised physical exercise is not only a feasible and safe addition to the standard treatments for first episode psychosis, but has potential cognitive benefits as well. A healthy diet has long been recognized as promoting better cardiovascular health and lowering the risk of certain cancers. But now promising research is showing that it might also protect against cognitive decline. This is an example of where good coordinated specialty care for first episode psychosis can assist. Case management, for example, could help someone that they're working with in creating a shopping list and then helping them to navigate the grocery store. And sleep. Our bodies rely on regular sleep for a variety of essential functions, many of them in the brain. Studies have shown that people who regularly sleep less than the recommended 7 to 8 hours per night score lower on tests of mental function. This may be because that learning and memories are consolidated during sleep. Therefore, getting consistent, good quality sleep is known to improve overall health and might prevent cognitive decline. Sleep hygiene could be addressed by members of the first episode team as well by providing education, assessing for problems, making referrals, and so on. Maintaining a healthy brain often equates with the habit of staying mentally stimulated as you age. Reading, learning new things, getting better at old hobbies, keeping a schedule, and generally engaging your thinking skills are great for your brain, like working out your brain. And people with strong social ties are less likely to experience cognitive decline than those who are alone. By contrast, depression, which often goes hand in hand with loneliness, correlates to faster cognitive decline. In addition, having a strong network of people who support and care for you can lower stress levels. And social activities require it requires you to engage several important mental processes like attention, memory, and those again strengthen cognition by working out your brain. While coping with cognitive impairments for individuals with psychosis can be challenging, there are paths to recovery. Research supports cognitive remediation as a training approach designed to reduce cognitive deficits and improve cognitive abilities. Evidence has shown cognitive remediation can improve memory, attention, executive functioning, and other cognitive abilities, sometimes including social cognition. And many times we see that cognitive remediation improves overall quality of life. One cognitive remediation expert said, by focusing on cognitive health in addition to mental health, cognitive remediation seeks to improve critical thinking skills, enabling people to be more effective in their daily lives and pursue their goals for recovery in a purposeful and meaningful way. There are two cognitive remediation programs that the Best Center supports. They are cognitive enhancement therapy and action-based cognitive remediation. Cognitive enhancement therapy is a cognitive remediation program where participants work at recovery through developing and working towards goals and structured group and computer exercises. Action-based cognitive remediation uses goal setting, behavioral activation, and role plays to show how new cognitive strategies are used with real-life tasks. When seeking treatment for cognition, keep in mind the following. Good care, including shared decision-making as in all FIRST services, careful choice and dosing of medications that will help to avoid adverse side effects and lend itself to better adherence, a well-rounded treatment team that addresses not only the illness or injury, but also the deficits themselves. And we know that a positive attitude about learning helps people make the best use of their cognitive skills, and a supportive and stimulating social and physical environment encourages people to cope better with their cognitive problems overall. Those with severe mental illness tend to underestimate themselves and their abilities, leading them to avoid cognitively challenging activities even during treatment. Keep in mind that providers are needed to play a key role in refocusing an individual on their goals of approaching cognitive challenges. So if you're working with people that have these issues going on, being that provider that gives praise and reinforces everything from showing up to completing a program is vitally important. And to maintain a healthy cognition status, remember to reduce risks to cognitive health, consider things that individuals can control to improve brain health. Take care of your physical health, like managing high blood pressure, eating well, and being physically active. Keeping your mind active, hobbies and volunteering. Learning new skills is not only good for your brain, but it boosts your self-esteem. Stay connected with social activities. Studies show that people who engage in personally meaningful and productive activities with others tend to live longer, have better moods, and have a sense of purpose. These activities help maintain well-being and help maintain cognitive function. Many stress-relieving activities have multiple benefits. Exercise is used not only to take care of physical health, but manage stress, engage socially, and try new things. So to review, good cognitive health is key to good quality of life. The gold standard of care for improving cognitive health for individuals with schizophrenia spectrum disorders is both early intervention by coordinated specialty care for first episode psychosis, and if appropriate, cognitive remediation. And that's the end.